A Beautiful Mind by Max Rothschiller and Kaitlin Vasquez. John Forbes Nash Jr. was a genius mathematician who attended and earned his PhD in mathematics at Princeton University in the 1950s. He was portrayed by Russell Crowe in the film A Beautiful Mind. The film setting changes as the movie evolves and follows the timeline of John Nash's life through his battle with schizophrenia. John Nash was diagnosed with schizophrenia, which is a serious mental disorder in which people interpret reality abnormally. Characteristics include hallucinations and delusions, as well as behavior that impairs daily functioning. John ended up being diagnosed with schizophrenia in the middle of his career, and it threw a huge set of obstacles that he had to overcome. Upon being checked into a mental hospital, they gave him extensive insulin shock treatment, which had a great physical and mental toll upon him and his family. This showed that back then the idea of the brain and mental disorders was completely skewed during the time period. John was diagnosed as if he was a crazy person. Being tied down and shocked was not good for his mental health, as well as the cocktail of drugs that they had him take for years after he was checked out. Upon some research, there are many cultures throughout the world who do not accept people with mental disorders. They are shunned in most situations or locked up in hospitals their entire life. They are not cared for as well as they should be and are almost treated as if they are not people. The stigma in American culture I have observed among people has shown that some people have a tendency to look down upon or treat someone with a disorder differently.
Symptoms of schizophrenia. In A Beautiful Mind, John Nash displayed many symptoms of schizophrenia. The recurring most common symptoms that he displayed were hallucinations and delusions. His delusions consisted of having feelings that people were always after him. His paranoid delusions were combined with his visual and auditory hallucinations. John's hallucinations consisted of his roommate Charles and Charles's niece, and he had a close relationship with them, and he not only saw them but had conversations with them as well. John has shown most, if not all, symptoms of schizophrenia, but the weakest symptom that he has is his body movements. Treatment. A normal treatment plan consists of antipsychotics, which are medications that help reverse the symptoms of mental diseases/disorders. Psychosocial treatment is usually followed and is used to talk about the mental disease/disorder in order to understand it and stop relapses from happening. This treatment and process is important for patients with schizophrenia because there is no known cause for it, and this is the most effective process known. On another note, there are some ethical concerns brought with treatment of schizophrenia. Ethical concerns and problems treating John. The concerns include that medications might not be accurate with their symptoms, psychiatrists might mix up schizophrenia with paranoia or other disorders, and how accurate the help is that the patient is getting. In the movie, there were some issues that kept John from receiving proper treatment, such as John was feeling as if the medication that he was taking was hindering his ability to learn and think the way he used to. So he stopped taking these medications, and the delusions and hallucinations relapsed and became stronger. Broader perspectives. John Nash, in A Beautiful Mind, portrays the disorder of schizophrenia perfectly. His hallucinations, delusions, and lack of interpersonal relationships demonstrates the symptoms of this disorder well. His lack of social skills, awkward moments, and how he makes unusual decisions shows how a person with this disorder would outwardly project themselves. This film can help people understand the effects of schizophrenia and how people live with this disorder every day. This film can help people understand the effects of schizophrenia and how people live with this disorder every day. The treatments portrayed in the film many years ago give the audience a false sense of what the disease looks like when they hear about it in real life.